All right, good morning, folks. Today is January 24th, 2025. This is Coffee with Community Services, Alta California Regional Center's weekly service provider meeting. My name is John Decker. I'm the Director of Community Services at Alta. Thank you all for joining us today. Let's see, we've got 66 folks on so far. As per usual, I will introduce staff and then get into our agenda for today. So for today, I see Christy on and Boyd from Community Services and Dan and Virginia, and our Client Services Manager Dana is on. Good morning, Dana. I also see Ethan and Michael from Community Services. Good morning. And Odelia and Alicia and Christine and Kylie. Our manager Michelle is on, and Scott, our QA manager. Good morning to Hubert and Jaslyn as well. I see on our manager Helen and some of her team, Beverly and Jessica. Good morning, and our lead Jason and Chris and my assistant Zach are on, as well as Marty from QA and Mason, Carly and Tom. Nice, got a lot of folks on today. Good, because we're going to be talking about rate study stuff, and I think this will be a good opportunity to update our staff even further. We just met with folks yesterday, and even more changes are happening today. So, for our agenda for today, we have our sign of the week in Deaf Culture 101. We also have a presentation from 211 Sacramento. We have some announcements from PEC. We have an update on HCBS from Scott. We have another update from Kylie as well, and we are going to talk about rate reform, and we're going to talk about billing for the month of February. So I will throw it over now to Michael.
All right, hello, good morning, everybody. So our signs for the week, we're gonna have three: happy birthday, cake, and candle. So first, this is the sign for happy. We can all do it together. Can you see me? Okay, so happy, and then with your middle finger, birthday. So happy birthday. Then we have cake, and then candle. So it's like the candle with the flame. Great. So now for Deaf Culture 101. Topic today, if you weren't able to see it, I'm sorry, it's the Invisible Accessibility Deaf Card and how it works. So we're going to just say deaf card, but really what it means is accessibility deaf card. It's not a real physical card. We typically will use that term to mean any type, if you need any type of help, or if there's maybe an awkward situation that you'd like to avoid, you can use the deaf card. It's a social tool, makes it easier for communication and accessibility, to help feel a little less awkward with some hearing individuals. For example, with concerts or live shows, typically you'll reserve seats in the audience. Interpreters are usually in the front. So front row seats are typically expensive. So we're able to say, oh, I'm deaf, I need to sit closer to the front for accessibility reasons to be able to see the interpreter. So that's an example of using your deaf card. Another example is maybe you're walking at the park or you're out somewhere, and sometimes you might have a stranger come up and they are verbally speaking to you. Maybe you're tired, or it's just your time to enjoy, and someone comes up to you that you don't know. You can just kind of point to your ear and go, I'm deaf, without feeling awkward and having to try to stop a conversation. Another example is asking for discounts because of lack of accessibility. A good example is for a train. You can ask for a discount because typically trains do not have written announcements, they're all verbal. So because of that lack of accessibility, we can typically ask for a discount. I have had experience with especially the train tickets. If I'm standing there and waiting and I'm trying to figure out where's my train, and they announce that the train moved tracks, and I did not know because it was a verbal announcement. So we can ask for discounted tickets for that accessibility purpose. Another example is at the airport. When you arrive at the airport and if there's a really long line, you're able to go and use the disability line. Because I've actually had an experience where I was in a long line, and once I got to the actual TSA agent, it turns out it was the wrong gate. So I had to go all the way over to the other gate because I was not able to hear the announcement that it had changed. So being able to go in the disability line is the use of that deaf card. So these are just situations that we might experience where the deaf card can make it easier. It's not about taking advantage. It's just about making our life easier and more accessible and more equivalent to our hearing peers. Thank you so much.
Excellent. Thank you, Michael. Very appreciated. And all right, I think I am going to throw it over to 211 Sacramento now.
All right, can you all see my screen?
Looks perfect.
Awesome. Well, first, thank you so much for having me here. This is my first time here, so I'm very excited. My name is Megan Etheridge, pronouns she, her, hers, and I'm the community project coordinator at 211 Sacramento. And I'm just going to talk a little bit about 211 Sacramento and generally what we do. So 211 Sacramento is really a hub of information, and our database consists of nonprofit and government agencies that provide health, human service, or disaster programs and resources to Sacramento County residents. I will also say we partner with 211 YOLO, so the 211 YOLO team and the 211 Sacramento team are the same people, but we are technically two different agencies. So I'll be focusing on 211 Sacramento today, but 211 YOLO generally offers the same services. So we have thousands of detailed programs and service records in our database, and this is the information that we're able to share with our callers to get them connected to whatever program that they may need. I like to highlight that most of the time we don't offer the service, but we offer the connection to the services within the community. So we provide information on and referrals to over 2,800 Sacramento County resources. 211 is accessible 24/7, so be that weekends, holidays, 3 a.m. on a Tuesday morning. We're there with a live agent to help get you connected. And our specialists speak Spanish, Thai, Lao, Mien, and English. And we also have access to a language line 24/7 that allows us to connect with interpreters who speak 200 different languages and dialects in addition to what our specialists speak directly. So looking at our core services, as shared, we provide information and referral services to Sac County residents 24 hours a day, 7 days a week. We do so over the phone, or individuals can look for resources in a self-guided search on our website. And this is for those who may not be comfortable speaking on the phone. I personally don't love speaking on the phone. I prefer to go online if I can. So it really is just about meeting people where they're at. And we also have one of our information and referral specialists located at the Family Relations Courthouse to assist families in getting connected to legal resources if they're there. So he can provide brochures, flyers, information on various community resources. And he's not a lawyer and he can't provide legal advice. However, he does have that capacity and capability of referring people to those legal services in the community. And he's there Monday through Thursday, 8 to 4:30. right now is a good time to bring up that we offer appointment scheduling for certain scenarios. So we are currently in our busiest season, which is tax season. And that's where we help set up appointments for many callers to get their taxes done for free. We are focusing on low income callers and senior callers, and for tax appointments, I mean. And then we also offer application assistance for CalFresh, where we assist them in applying over the phone and then directly submitting the application on their behalf. And then finally, we have information on the seasonal programs such as Thanksgiving turkey distributions or baskets, Christmas baskets, and summer meal programs. So a lot of the time, people may think that we only offer information on one category of service. Perhaps someone may have gotten assistance for a housing related issue, which people often do, and that's now all they associate us with. However, you can see on screen here that we do have a multitude of service categories that we're able to provide referrals to, and they cover things like housing, food, family, senior, youth services, mental health or substance abuse, healthcare, either physical or mental health care, transportation, military or veteran specific resources, all the way to the individuals experiencing homelessness or who in some sort of housing crisis. And then I do want to just highlight one of our special projects that we work on, which is the Coordinated Access System. If you are a social service provider in Sacramento County, you've likely heard of this. But CAS is the Sacramento region's framework for accessing shelter and crisis resources. So CAS works to connect individuals and families experiencing homelessness or who are at imminent risk of homelessness to shelters and services to help them divert from homelessness. So it was really developed because there were some system-wide evaluations done that found that for both providers and households, it was really hard to navigate the shelter system. So CAS was made in order to streamline the system, to streamline how individuals get into the county shelters. Now, CAS itself is also available 24/7 by just dialing 211, and you get connected to a 211 CAS specialist who focuses on two main pieces. One is establishing centralized access to shelter, and the second is problem-solving diversion efforts. So the shelter access is for those who are currently experiencing homelessness, while the diversion efforts are those who are at imminent risk. And then just to dive a little bit deeper of what those shelter assessments are, because these are some pieces that people are not always aware of. So individuals and families can be assessed by our specialists to be placed on the shelter waitlist. And these assessments take on average about 10 minutes, but they're only valid for 90 days. So the shelter assessment must be redone at least every 90 days. An individual can redo them by calling us and redoing their assessment. However, if a household situation has changed, they need to tell us. If their phone number has changed, they need to tell us. If they lose their phone, they need to tell us, just so that way we can update them and reach them if a space becomes available to them. And then finally, the types of shelters that CAS covers are individual shelters, family shelters, and transition-aged youth shelters, which are for individuals 18 to 24 years of age. So that was just a little quick summary of what 211 does. But we always like to say we're a no wrong door sort of phone number to call. So you can always just call us by dialing 211 24/7, and we can figure out the best next steps for you in terms of what your situation is.
Excellent. Thank you very much. I'm going to pop over to the chat. And it looks like folks are hoping that there's a flyer that you can share. I'm hoping that you can share your email for folks. And if you have the ability to even drop your PowerPoint in the chat for folks, they might appreciate that too.
Yeah. So if anybody is in need of resources or connection to resources, they can reach out to this info@211 Sacramento email. if anybody is needing to connect to me, I can put my email in the chat. I will put our screen reader accessible flyers in English and Spanish in the chat, and I can also pop a PDF of this presentation in the chat as well.
Well, Megan, you have a very large crowd of not only service providers, but a number of our case management managers have joined as well. And I see Carol on and Toby on and Laura on. And I wonder if maybe it would be beneficial for us to do another training for our client services managers or possibly for our service coordinators related to this stuff. I don't know the extent to which everyone's familiar with all the things that are available, and my goodness, it certainly crosses over significantly with a lot of the situations that we're doing. So I think so. Maybe we can invite Megan to talk with case management at one of the meetings, Team Unity, something like that. All right, I see a bunch of nodding heads. Cool. Again, we do these meetings in order to ensure that our community of service providers are very well informed, and being able to bring in guest speakers and talk about the resources that are available around us hopefully just makes so much better connections for the individuals that we jointly share, even just identifying individuals. So thank you very much for that, much appreciated. All right, we are, let's see, Jordan doesn't know about this yet, but Christy Owasa, would you mind sharing, if you have your PowerPoint available, your presentation that you did yesterday?
Sure, I can do that.
Just kind of you can go over the graphics. We don't need to get into a ton of detail, but just if you could just please share it, because it was awesome. And I think it really illustrates what we're trying to do to get people out of institutional type settings.
Thanks.
Okay, how's that looking?
It's great.
Okay, all right. So community crisis homes, oh, wait, how do I start the presentation?
PowerPoint mode, right? You can either click on that bottom.
Yeah, but my Zoom button is right over it. There we go.
Okay, cool.
Okay, now I got it.
Okay.
All right, so crisis homes are just 4-bed facilities that are located in the community. The purpose is to step people down from locked settings or to prevent them from needing to go into locked settings. The purpose is to stabilize their behaviors and give them the skills that they need so that they can live in lower levels of care. They offer a lot of augmented services with extra behavior management services and extra other consultation. And the staffing levels can be flexible to whatever the individual needs. So if they need 1-to-1 or 2-to-1, we can make that happen just within the facility. We don't have to go through a lot of hoops. So we can meet the need quickly. And the purpose is a time-limited stay. So for adult crisis homes, the maximum time is 18 months. And for a children's crisis home, the maximum time is 12 months. So we currently have 6 community crisis homes. We have 2 that are regional resources for adults. That means any regional center can use them, and their purposes are to step people down from institutes of mental disease, such as College Hospital. And then we also operate a regional resource, which is a children's crisis home, and that's located in Rio Linda. And then we have 2 homes that are in development, the WellCare Rio home in Alberta and the Cala Springs home in Shingle Springs. And then we also have Cala Senior located in Orangevale. So a really good opportunity to keep people from having to go into locked settings. So since we opened up our first crisis home in 2018, we've stepped down 29 individuals. Now, we've actually stepped down more than that, but these are just Alta clients that I've collected data on, since we do help other regional centers. So 29 have stepped down, and this breaks up the transitions by year. And if you note, in 2020, when everything was shut down and weird, we moved the most people. So that was really awesome to see. So where did they go when they stepped down from the crisis home? Most went to enhanced SLS. We had 1 go to regular SLS. A few went to enhanced behavioral support homes, which offers the same level of service as a crisis home. It's just not time limited. We had 3 go into a specialized residential facility, and 3 went into 4 eye care homes. We had 1 return to family, and then we had another one who went AWOL from the program. But so where are they now? Since all of those step downs, 24 of those 29 are still in the same living situation that they transitioned into from the CCH. So if they step down to enhanced SLS, they're still in their enhanced SLS or their care home. So they haven't had the same loss of placement that they were experiencing before the crisis home. 2 went to an even less restrictive setting than the one they stepped down into. And then we've unfortunately had 2 go into a more restrictive setting. But I'd say 24 out of 29 is really good success for these individuals that were really struggling with stabilization and living a successful life that they wanted to live. And the clients are just really getting to experience the life that they wanted to have. So, there you go.
Thank you very much, Christy. Again, I feel like this kind of shows a little proof of the concept of having community-based kind of secure treatment type of homes instead of having people be in these locked settings. And I will say the genesis, or at least for our regional center with this, and Carol would remember this, Carol Wilhelm, is that in the past, a decade or more ago, we would have, for example, a Institute for Mental Disease that was closing, and we needed a place for the individuals to go. And where would they go? Into supported living services. And so around that time, I remember the discussions with David Rydquist, who was our previous director of client services, who said, is there just a place where we can have like in between, so that if we do need to get people into these supported living services, there's a place where they can reside safely, they can get the supports, and we can get things like their benefits set up, and we can get an understanding of what kind of things they like to do during the day, as opposed to a direct move right into supported living services, which we had found was not always very successful in some of those cases, coming from a locked setting or an institutional setting. So being able to have these community crisis homes that allow us to provide a lot of supports to individuals, but then to be able to have individuals move from that environment out into homes of their own with the supports built around them, again, I think is where we really want to be aligned. That's in 2025. That's where our regional center is looking at, as far as ensuring individuals have the most opportunities for choice. So that being said, I really want to commend, I know Toby's team certainly works very hard with these types of homes on the case management side of things. And Christy and Jordan and all the CPP staff, lot to be proud of there. I think, again, this is something that no one has kind of looked at it statewide, what the impact is of this, but these are great numbers, I feel like, for our regional center. And kudos to each of you that have supported these individuals, because some of you are on this call right now, either in day programming or in their SLS arrangements.
Thanks, John.
All right. Kate.
Hello. Let me share my screen real quick.
Go for it.
For some reason, it's not letting me. It doesn't matter. I am going to put a flyer. I was just going to share a flyer about our very first ACRE customized employment training. We've been getting a few requests to do the training in virtual format so that it's more accessible to learn and also to get your national certification. So I just wanted to make sure we're spreading the word. And it does start in a few weeks. So make sure that you register soon if you're interested. Like I said, I'll put the flyer in the chat. It outlines the dates and times that the virtual trainings will happen. So take a look. And if you have any questions, I'll also put my email in the chat as well. Thanks.
Excellent. Thank you very much. Let's see. We'll do a HCBS update with Scott, and then we'll throw it to Kylie after that.
All right, thank you. So HCBS has we're starting up in February on our next round of visitations, and we're expanding those sites to encompass some additional service codes. So what you'll be seeing in this next round is that we're branching out and reviewing some of the CCHs, the EBSHs, more day programs, and then also the programs that were vendored after, I believe it was March of 2023. So emails are coming out. You are also going to be getting a letter, and there's an opportunity, if you respond to the letter, to actually get these scheduled as per your requirements. If we don't get a call from you, we're going to have to schedule them ourselves, and there'll be an unannounced visit. So I know that we've already sent out the first wave of notifications, and several have already been scheduled. There's about 13 vendors that have scheduled with our specialists so far. So we know that process is working. In that email, there is a table that will show you who your assigned HCBS specialist is, and you can reach out directly to them and get that scheduled. There's not any changes in terms of what we're looking at. The forms we're very transparent. The documentation that you'll be receiving will show you all of the different 10 federal regulations that we're looking into. And so our forms haven't changed. I don't think there's anything else on that right now. So if you do have questions, you can always reach out to the HCBS inbox, which Kylie, if you could throw that into the chat. I believe it's just HCBS at Alta Regional. And then that's all I got for today, John.
Awesome. Yeah, again, I'm hoping as we transition from our previous activities and trying to meet all of those deadlines, and we move into this maintenance phase of going through and doing these QAs, that if you have questions, reach out to Scott, reach out to me, anything related to it. But I thus far been very pleased with how things have gone. But we were able to write a year-end summary to our board of directors and highlight all of these fantastic HCBS reviews that we were able to have with our service providers, which speaks to the work that you guys are doing as service providers, because that's how we were able to assess your compliance. So again, kudos to you all as service providers. Kylie.
Hello, everyone. I really quickly just wanted to plug a really great training opportunity. You guys are seeing my screen?
Looks good.
Awesome. Okay, so this is a training opportunity offered through STEP agency. The purpose of this training is to increase the knowledge of DSPs on best interactions with deaf individuals to increase community access. This is a paid training. So I just want to highlight that. It's a really great opportunity for DSPs and agencies to get in contact with STEP. The QR code you can scan at the bottom to sign up, and then also email the email listed below. And I see Jay's in the chat too. So yeah, I just wanted to plug this. They have been super flexible with working with this training. There's no dates listed because Jay and his team are making it really flexible. I believe offering it online and in person. So definitely reach out to them to learn more about this paid opportunity. That's all I got for you today. And I'll leave the flyer in the chat as well as the email.
Thank you very much. All right. Dan, if you would not mind, we can give folks an update about our CPP, CRDP responses. I know you had the numbers in the chat there. So every year we do a request for proposal, And with that request for a proposal, we do orientation, and then we also get applications back to review. And so, Dan, how did we do this year?
I think we did okay. I mean, obviously, there's a big response for the adult step down home, which makes sense. We have a lot of adult homes and providers, so we tend to get the most applicants for that. The group homes, we got 6 applicants. That's by on par what I would expect. And then for day programs, we had the 3, which is a little bit lower than what I was anticipating, but we just need 1, right? And then a few for the dental, and then 2 for the wellness center. So at this point, we have a couple weeks to review and score these, and then we're going to go into interviews, and hopefully by in a month or so, we'll have new providers.
Yeah, and I put our timelines in the chat just so folks are aware of when we'll be finishing our proposals and the weeks we'll be doing interviews. So just so folks are aware, that information is also available on the actual RFP proposal handout that's on our website.
Hey,
Well, thank you, Jordan.
hey Dan, while I have you on, I believe you have another FMS vendorization announcement, like is it ready to go, or where are we at?
Yeah,
Ridgeline.
so yes, so Ridgeline FMS is officially vendored. The announcement will be sent out here in just a few minutes. So our agency will get blasted with this new vendor. And then we have another one, HR Alliance West, is actually being processed as we speak.
Awesome. Excellent. So we got to meet the HR Alliance folks a few weeks ago.
Yep.
And again, this is a new type of vendorization for Dan to do, and he took on the responsibility. And I brought it up because this was in response to RFPs. We did a request for a proposal at the end of last fiscal year. We used some unused purchase of service funds in order to get FMS agencies that are willing to work with our clients. And in the chat, Dan, we have a question, I believe. So I gotta just keep scrolling down to the bottom.
Let's see.
Will either of the new FMS agencies be willing to be employer of record for PIPs? I believe both of them were required to do so, right?
Yes, I know Ridgeline will. I'm not sure about HR Alliance
Okay.
Yeah.
All
at
right.
this point.
Okay.
Yeah,
All right. Thank you very much, Dan. Much appreciated.
of course.
Additionally, I want to give folks just an update real quick. Carly has been working really hard on a lot of the DSP Collaborative information, and some of you are familiar, and I'll share my screen with the DSP Collaborative website that we have put up. We did have an opportunity, or I had an opportunity, I should say. I was going to talk with folks about it last week, but didn't get a chance. But I had an opportunity to speak with the executive directors of the regional centers last week at the Association of Regional Center Agency meetings, and we discussed the next steps of the DSP Collaborative. And so what we are looking at is a expansion of the DSP Collaborative to Los Angeles County. The 7 regional centers that are in Los Angeles County have a shared media market, which was one of the ideas behind the DSP Collaborative and the job board. So we're going to be looking at the utilization of HCBS funds, and I just would share that the regional centers in Southern California are all on board. Regional centers like, for example, Central Valley Regional Center that borders us right here, and Tri-Counties and others are all really interested in joining. And our plan is going to be that we are going to expand next year in July to the Los Angeles County Regional Center areas. We're going to see how that expansion goes. And then the year after that, look at expanding statewide for the DSP Collaborative. I don't have it handy. If one of you do, maybe we could drop it in the chat. But our understanding and our discussions are that there's still, certainly a challenge as it relates to our DSP workforce and ensuring that we have enough qualified, well-trained DSPs to provide the individualized supports that we need for, the type of inclusive living for regional center clients. So with that, and if anyone has it, the California Policy Center for Intellectual and Developmental Disabilities just put out a report about the DSP workforce and the challenges in the state of California. And so we still see this as a big issue. We recognize that we do have currently quite a few high-level residential care homes that are well staffed and have a number of vacancies in them. But across other staff, across other services, whether it's employment services or day programs or supported living services or ILS services, we're still hearing about significant challenges being faced by service providers. So we're going to keep continuing to push forward these types of things like the DSP collaborative. If we have another opportunity to do something in the future, like those DSP stipends that folks had opportunities to do for training, we're going to push those things forward too. So we will stay tuned. We'll let folks know more about the expansion of the DSP collaborative, but I want to certainly acknowledge Carly, who works very closely with our contractor to make sure their website is up to date. And also that we could expand the website database to the other regional centers. So again, we'll talk more about that with folks in the future. And I am now going to go over and discuss about rate reform. So I'm going to share my screen here. And hopefully we can get everyone on the same page and answer people's questions. All right, are we all seeing DDS's website? Yep, perfect. Okay. So on DDS's website, I'm going to be navigating to the rate reform tab here. And let's see, we have a lot of people on this meeting, 109 people. I'm assuming some folks that maybe have never been on these meetings before. So I will just identify that the meeting information is located here. This is where you can find the service-specific webinars that were held by the Department of Developmental Services, and you can watch those meeting recordings. I encourage each of you as service providers to watch the recording that is on DDS's website that talks about your new rates, the new rate methodologies. Some of them, are not the most complex in the whole world, but some of them there's significant changes that are going on amongst the specific services. So just encourage folks to take a look at the information located here at the Department of Developmental Services website. So navigating back to rate reform again, we have a couple of other tabs here. We have the rate models and rates. So again, as a service provider, if you want to be able to see how the Burns and Associates HMA rate study was calculated for your specific rate, you could find the complete rate models. If you want to know what the post-transition rates are, and you'll remember that term, post-transition rates are for our service providers, you'll find those rates here, and they were updated on January 3rd. We know that as an update, what we have learned is that the rates are fine, but that we still have the workbooks that are not quite 100% accurate, and we will share with folks about that a little bit. Rate reform directives and updates. So within here, we're going to go over a couple different things, but this is where the specific directives are. Again, please review all the words that are on the directives, and also watch out for things like an updated employment directive. This updated employment directive was just posted, and it talks about supported employment groups, and the director previously had said that the minimum size of a group is reduced from 3 down to 2, and they've struck that out. So again, this is why it's important to go on to DDS's website and take a look at these, because this is where they post their directives and give updates on things, including things like the service code crosswalk, which we'll go over that one as well. All right. So I feel like this is the discussion about transitional rates is most important to these service providers, the 048s, the 055s, the 063s, the 505s, all of these ones. To me, those are the ones where the transitional rates may not match the post-transition rates. Am I saying that correctly, Michelle Duchesne? I feel like I'm saying that correctly. All right. So for the transition rates, and the reason why is that the transition rates that we receive for you right now that we're putting on your rate tables align with what your current rate methodology is, the same way that you've been billing ever, all throughout the rate study. However, it does apply the final post-transition rate to your service. So that is the So that's the two rates that are going to be on the rate table for you. So as an example, and I kind of want to clarify how we're going to be transitioning these. We already have your transition rates. And again, the transition rates are 100% of the rate model that we plan on transitioning you to. So we already have, those transitional rates in. Excuse me. So for these 048 providers, if they have a monthly rate currently, we already have the calculation to be able to give them like a transitional rate, or we have the ability to do that, to give them a transitional rate so that they can still bill for the month of January with their previous rate methodologies. Let's say you're a day program that is going to be moving from a daily rate to an hourly rate, for example. How we're looking at doing this is that your current authorizations that you have right now are going to be continued to be built on with your current rate methodologies. We're going to be working to get service acknowledgement forms from you and doing those. Once we have those service acknowledgement forms, we're going to be transitioning you to the new service codes, and you're going to have the new rate study rates for those. But that's going to occur for your existing clients. That will occur like when the auth ends. Let's say the auth's going to end in like February or something like that. Then when we write your new auth, then we'll write it with the new rate study rates, the post-transition rates. So there may be in a month you doing billing both at a daily rate and an hourly rate for clients, if that makes sense, until we transition your existing clients over to the new hourly rate. I'm using this as an example because in some services, we may also need to have an IPP meeting that re-describes what your services look like. So like in Helen's case, we're going to want those monthly rates to go away, and we're going to want them to transition to these rates right here. But we're really going to need an IPP meeting to describe how many hours of each of these individual services are going to be provided, as opposed to what we had previously in our IPP, which was this 048 program can do 25 hours a month, if that makes sense. So again, what our charge is with our staff is to take a look at primarily these services here, the 048s, the 055s, and just make sure that we're categorized correctly. And so, Andrea, I know we talk about this during the PAC meeting, and we've talked about the hold harmless and stuff. Would you mind if I kind of used you guys as an example a little bit, maybe? Yeah, is that cool? So in a situation like the like in Alliance CTP 1-to-1 program, if we categorize you like right now as a hourly rate day service, you're going to fall into the hold harmless at that point. Like you're going to be, in essence, in the hold harmless likely, because your rate would be higher than that. However, if we categorized you as a behavioral day service, then you are then saying that I am going to change my program design so that between now and the end of this calendar year, I'm going to align with the description within the directive about what a behavioral service is, including the 2 hours of behaviorist. So that's in essence the choice, my understanding, that could be made for a provider at this point. The third thing would be we want to be exempted like from this. We want to stay where we're at, and we're still recognizing that the hold harmless only goes through June of 30th of 2026, but that would be, you know, an option as well. So this is the discussion that we need to have with some of these providers is, you know, do you foresee that your program is going to be at a place where when we start up the QAs on these effective January of 2026, that you're going to be aligned with the new directives or not? And so now, you know, again, now the rates are out there. We can show people the difference between, you know, being a 531 or being a behavioral day service, or again, people staying with their rates and then not wanting to do that transition. So I think our preference, honestly, is to get people into the new service codes as quickly as possible. But that's kind of, so I just kind of wanted to bring that up. And then if folks had questions, and I can check the chat too about this, because let's see. Is the exemption permanent or just until the hold harmless? Yeah, I believe there's nothing that goes past the hold harmless. So the hold harmless, at that point, I believe we can no longer, I mean, you would, yeah, I don't know. Yeah, we haven't necessarily landed from the department on what happens if people say, no, I'm not going to sign this as well. It seems like it would make sense that we would roll the vendors to whatever their rates were before the rate study increases started coming in, because they're not going to comply with them. Andrea, yeah.
So are you saying over this next year that all of the day programs that are a daily rate will be transitioning to hourly rate?
Yeah. Yeah, that'll get everyone aligned into hourly rates, which is going to be the eventual rate model as well. But that doesn't mean that, like, you know, so like if you bring on a new client, your new auth is going to be at an hourly rate, basically. So we're going to add hourly rates to the daily rate vendors. And so if you get a new auth, especially if you're going to stay with, you know, well, you're going to move service codes, but we're going to have both of them in there. So that might get a little confusing for folks that are only used to seeing daily rate billing.
And it's a little confusing as far as how we do it currently to switch like right now. So
yeah, yes. Yeah, that is a discussion that we are having right now, is what is that impact for providers that
quite a bit.
an immediate switch. Even just how you track things too, right? So again, that's the plan, is that as we have, you know, the transitions occurring, and you as providers start preparing yourselves for getting into an hourly rate method for billing for everything, because that's what the rate study is looking at doing. Same thing on the medical side of things. If, for example, even if we categorized you previously as like a medical day program, you're going to be receiving the medical day program rate like effective January 1. So like Andrea, in your case, you're receiving the behavioral rate effective January 1, like one way or the other, because that's the way you're categorized. And so, yeah, as I say, it would be up to our discussion with you as to whether or not you want to decide to maintain that, or whether or not you want to look at moving over to your other rate and just be held harmless. But we'd have to wind back a couple of the rate increases. And this is the same thing. This is going on all over the state right now, because during the course of the rate study, regional centers worked with service providers to categorize kind of who was doing what kind of consultants people had. And it made it a challenge because it didn't always align when the workbooks entries got done. But that is what we're working on right now. We as a staff have a very long list of service providers that look like outliers, that look like the hold harmless is off significantly. And also we have the list of these ones as well. And so that's our priority as far as contacting our providers and identifying those individuals. And I know I've got meetings all this afternoon with Helen's staff. We're going to be taking a look at a bunch of the service codes to try to determine where folks are going to land in here for any that may have had a challenge during the rate study earlier. And then let's see, and then we also have some supported living providers that I think Michelle and Jason are going to be following up with directly, if I remember correctly, to talk about some of those fixed cost rates that folks had too. So that's the big, plan of what we're trying to do here is just ensure that we have the appropriate transitional rate, which is where we think which is what we think your post-transition rate's going to be. But again, your transition rate allows you to still use your previous billing methodology if it was different, and get the rate increases. All right, there's a question in the chat here. As a new provider with ACRC, we have not yet submitted our first POS or completed billings. Will this affect our rate reform process? Are there additional or fewer steps we need to take to give our current status? Also, can you confirm that sending the acknowledgement documentation will not be required until we receive the official rate workbooks? Thank you for your guidance. Oh yeah, I forgot to mention about the workbooks. So the official workbooks are a little bit of a challenge because we don't have accurate workbooks across a lot of the service codes. There's a number of issues that were found throughout the workbooks that were developed by the department. We waited a really long time to get the 055 and the 063 workbooks, and they have errors in them, like errors in the formulas, if that makes sense. So what we've done is we have, in essence, downloaded all of your workbooks into one master workbook that has all aligned columns that we can use for our staff's purposes as well in tracking our work to make sure that we get a hold of every single vendor that we need to. But the workbooks that came from the department, it would be a challenge if we just sent them directly to you, because you would start seeing inaccuracies and challenges. What we're doing now is we are going through and fixing those. It's a SharePoint, so we're able to update the SharePoint and give the department, the accurate numbers. And then for care homes in general, we have a spreadsheet that has what your previous level was, and we got a column next to it, and we know where you're moving to because DDS has made it abundantly clear how we're crossing over from 4 Eyes over to the level 6s. And then Jordan's staff, I think, primarily are working on the level 7 facilities that are going to have which are their previous negotiated rates, specialized residential facilities, etc. So they're working on getting those rates. And again, for services that are not transitioning over to different things, we just want to get your rate increases to you as quickly as possible. We want to eliminate doing as many retro payments. So I want to see if there's any other questions. Yeah, there's no workbooks for residential providers, so we will not be sending those to you. But we will be sending you your rate. You will be able to see them. You're going to get a letter signed by me. All right, any questions? So again, our staff's going to be doing a lot of looking at spreadsheets here over the next few days. I've blocked off my whole day of Monday to sit in my office for anyone that has any questions about their service codes, and any of these ones that are crosswalking. So hopefully we'll give a good update next week to service providers on where we're at with that. We are working on a mail merge so we can get the acknowledgement forms out to you. Oh, Lindsay had one. Trivia night. Lindsay, are you available to talk about it real quick?
I am. I didn't want to interrupt. Rate reform's more important, but just another reminder that Futures Explored is having a trivia night on the 31st of this month. It's $10 per person. It's family friendly. It will be very accessible for lots of different ages, and we'll have an ASL interpreter, we'll have Braille options, we'll have a Spanish interpreter. It's from 6 to 9, and you can buy tickets at the door or through the QR code that I dropped it's in the trivia flyer.
Thank you very much, Lindsay. So again, we are going to be paying people their transitional rates at this time, and that is their previous billing methodology that they had, but it is a rate that aligns with what the new benchmarks are, and then of course the 90% of the quality incentive. There's a directive that is on its way coming out related to the service provider directory, so stay tuned. I think it may answer some questions that our service providers have. And we'll update folks on that next week, because I know there's still a lot of people that have questions about the service provider directory. Question about adaptive skills training. We used to have one rate. Now it was hourly rates be divided between the two rates. Any additional information on that? How do we bill for January? So for January billing, and we'll set this up for you. If you have a bachelor's level person and a master's level person, you find the time that that individual spent with the client, and you bill us for the time directly in front of the client. And follow up with your specialist. I don't know who's got that. It's probably maybe. Well, I know it's certainly in Helen's unit. So. All right, and that's the whole way the rate study works. That's the big shift in the rate study, is that it went from some of these group type rates where we might have more than one professional doing services at the same time.
You can stick around if you want.
And then it breaks down to just the individual that's doing the direct service. Because again, as I started earlier, the rate models have those overhead costs built into them when they develop the hourly rates. All right. Well, thank you all very much for joining us today. We'll look forward to talking to folks next week. Have a great weekend, and appreciate all the presentations from folks. Take good care.